Hi, my name is John Prodoehl. I'm a surgeon with Florida Orthopaedic Associates, and I'll answer some patient questions. An artificial knee is a metal and plastic uh, prosthesis. Um, Basically, what we do is we cut out the bad portions of the cartilage and bone and cap the joint with a femoral and tibial and patellar component. It is kept in position either through bone cement, or it could be kept in position with a cementless variety of a total knee replacement. There are various options that are available to the patient, and this can be discussed according to the patient preference.